Living with someone who experiences alcohol use disorder, or AUD, can really impact the lives of others. That can be within their family, or people they live with at home, or even their friends or their coworkers. That can have impacts in various ways. We can look at psychological impacts, emotional impacts, or even sometimes physical impacts. This really looks like chronic stress, increases to their symptoms of anxiety or depression. There might be fear associated with it too, because sometimes there's a level of unpredictability when it comes to someone who's engaging in substance use or alcohol use disorder. In children or youth within that family system, there can be changes in their roles or the family dynamic itself. So sometimes children or youth might take on more adult responsibilities, which really kind of adds some confusion to the role within the family structure and also emotional strain within that dynamic as well. In saying that though, there are protective factors too. So looking at connecting the children or youth or other family members to community resources or mental health support can be very helpful in managing these risks. If someone is living in a household where AUD is present, this can impact the child or youth emotionally in different ways. They might have some confusion or some guilt or shame about the alcohol use. They may have externalizing behaviors, so they might engage in more arguments. They may express it physically as well, so they might get in physical altercations. We can also see that children and youth withdraw socially as well. So they may no longer engage with their friends as much. They may not attend their sports or recreational activities as much. And research does show that children and youth in families who do have alcohol use disorder, they do have increased risk for mental health difficulties or potential substance use later in life, and they also have difficulty with emotional regulation. If we're actually looking at the diagnostic criteria of alcohol use disorder, we're really looking at the consequences related to the alcohol use, and we're looking at the patterns of behavior and the impacts of that. So things such as social impacts. So maybe there are changes in your friend or family group because of your alcohol consumption. So you might end up, losing friendships or family members because of your alcohol use. There are also occupational impacts. So you might lose your employment or miss several days of work or school. And then there are also psychological impacts as well. It can have co-occurring impacts with other mental health conditions, primarily with depression and PTSD. Another main criteria for AUD is also the impairment of your ability to stop your drinking or to control your drinking, despite the adverse consequences that come along with your alcohol use. So when we're looking at the risk factors or contributing factors of developing alcohol use disorder, genes do play a large role in that. Studies do show that 40 to 60% of your susceptibility for developing alcohol use disorder is genetics. There are specific genes that do influence how your body metabolizes alcohol and also how alcohol impacts the brain reward systems. There are a number of other factors that can impact your susceptibility to developing alcohol use disorder. So these are things like environmental factors and social factors. Looking at what your coping skills are and your history. Is there a history of trauma that would be important to address? Involving the family within treatment can really help not only the individual who's currently struggling with alcohol use disorder, it can also help break the cycle of addiction within the family. When you are in the life of someone who does have substance use disorder or alcohol use disorder in this context, it is also important for the family members to take care of themselves as well. Because I know this can be quite a worrying and stressful time for many. So making sure that you are doing self-care for yourself, doing things that bring you happiness and comfort throughout potentially a very stressful time. Setting clear boundaries can also be very helpful when you are living with someone who does have alcohol use disorder, and there are supports available. So we can look at support groups for people specifically who are living with someone who does have AUD. There's also individualized therapy that's available. So that can be one-on-one with a therapist, or it can be getting involved with a family therapy as well. There are several resources that are available for family members or friends that are experiencing a loved one with AUD. That can look like one-on-one therapy, so sitting down with a therapist to talk about how this might be impacting you on a personal level. Also, you can get involved with family therapy. Sitting down with a therapist and your loved one who is experiencing AUD can also be quite helpful in that process. And also there are a number of other resources within the community. So support groups for family members of those who are impacted by AUD or substance use related disorders in general. Horizon does have a number of community supports and services for people who are struggling with alcohol use disorder or substance use disorder. If you are looking to make changes to your alcohol or substance use, there are many options available to you. You can contact your local addictions and mental health clinic, or if you're under the age of 19, you can contact your child and youth team. These are teams of professionals that are able to connect you to the appropriate resources within your community. And it's also recommended that if you are looking to make changes to your alcohol use, that you do so in consultation with a medical professional or healthcare team.